Hi guys, let's see about retinal detachment today. It is the separation of the neurosensory retina from the retinal pigment epithelium. So it's a misnomer. So primarily we have a rhegmatogenous retinal detachment, which is the most common type. In secondary we have fractional and exudative types. Primary retinal detachment is due to a retinal tear through which the subretinal fluid seeps through and separates the retina. In tractional type, the retina is actually pulled away by the vitreoretinal traction bands. Exudative is there is some tumor or something which is causing exudative fluid in the subretinal space. So the most common cause for rhegmatogenous detachment is pathological myopia, and also that causes lattice degeneration and senile posterior vitreous detachment. Tractional, we have proliferative conditions like diabetic retinopathy, retinopathy of prematurity, and post-traumatic incidents. And in exudative, the most common causes are choroidal melanoma and also posterior scleritis, Coats disease, and central serous retinopathy. The symptoms of rhegmatogenous or primary retinal detachment include floaters, photopsia, and the patient will have a sensation of curtain falling in front of the eye. This is due to the extension of the detachment, and the patient complains of sudden painless loss of vision. Tractional, the Schaffer's sign is seen only in primary retinal detachment, and the detached retina is convex shaped in primary, whereas it is concave in tractional. It is convex in exudative also. Indirect ophthalmoscopy, we have in primary retinal detachment, we can locate the tears, and it is located based on Linkoff rule, and the patient can also have Marcus gun pupil. The world retinal detachment can present as a retinal atrophy, subretinal demarcation line can be formed, and intraretinal cyst can also be seen. For tractional retinal detachment, it is concave, uh, and then the retinal membrane mobility is severely detached retinal mobility is severely reduced. In exudative type of retinal detachment, shifting of fluid with the head position is pathognomic. Treatment for rhegmatogenous retinal detachment is prophylactically we can give laser photocoagulation of the tears so that to prevent the detachment. If there is an retinal detachment and the overlying retina detached retina is mobile, we can go for tamponade either by internal or external method. Internal, we can have pneumatic retinopexy or silicone gel, uh, and externally we can do scleral buckling. And if it is immobile retina, we have to do pars plana vitrectomy,